Assalamu alaikum. The paper for today is the impact of case difficulty, endodontic mishaps and instrumentation methods in endodontic treatment, outcome and quality of life. It's a 4-year follow-up study published by Joy in 2023. Basically, the main goal of endodontic treatment is to maintain the healthy periradicular tissue and the functionality of the tooth without patient discomfort. So a successful outcome after root canal treatment is often based on the absence or reduction of the periapical lesion radiographically, no clinical sign or symptoms, and no patient discomfort. In addition, an improved oral health related quality life after root canal treatment is desired. So the aim of this study was to investigate the treatment outcome 4 years after primary non-surgical root canal treatment with case difficulty in instrumentation, methods, endodontic mishaps, and corona restoration as a variables. A clinical examination and radiographic assessment were performed, followed by evaluation of the patient's oral health related quality of life using an oral health impact profile for 10 instruments. In the material and methods, 234 patients from a previous quality assurance study were invited to a recall appointment at the Department of the Clinical Dentistry at the University of the Bergen. Briefly, the 234 patients had received primary non-surgical root canal treatment in 257 teeth. The treatment was performed by 2 consecutive classes of 4th-year dental students. Teeth were categorized using the American Association of Endodontic Case Difficulty Assessment form. The endodontic mishaps that occurred during the treatment were registered, and the teeth were extracted, retreated surgically or non-surgically, were recorded as the early failure and excluded from the further statistical analysis. Regarding the clinical examination, all the clinical examination were performed by one examiner, and if the patient reported pain sensation, a numeric rating score in which O is 0 pain and 10 is the highest imaginable possible pain was used for quantification. For the radiographic assessment, a periapical radiograph was taken, and one observer interpreted all the radiograph using the PA index scoring system. Regarding the evaluation of the endodontic treatment outcome, the clinical success was defined as an absence of clinical sign and symptoms, and for the radiographic success, BA score 1 and 2 were considered. In this study, the combined or the total treatment outcome was defined as a successful if the tooth presented with the absence of clinical sign and symptoms and the radiographic BA score equal or less than 2. For the oral health impact factor, to assess the oral health related quality of life within the last 6 months, an oral health impact factor with 14 questions was used, which is widely used in epidemiological studies. Each question was assessed on the basis of the following response scale: 0 is never, 1 hardly ever, 2 occasionally, 3 fairly often, 4 very often in the last 6 months. And individual domain score is derived by summing up the responses of the 2 items within a particular domain, where score can range from 0 to 8. A total of OHIB 14 summary score is derived by summating the responses to all items, and score can range from 0 to 56. A high score indicated poor oral health related quality of life. In the results, a total of 149 patients attended the 4-year recall appointment. An unchanged or lower periapical index score at the recall visit was registered on 153 teeth. Radiographic success rate was 87.5%, and the clinical success, which is the absence of the clinical sign and symptoms, was 88.8%. Both radiographic and clinical success was observed in 78.8% of the teeth. Teeth in high difficulty category instrumented with the engine-driven files and molars presented with significantly more clinical sign and symptoms, but not high BA score. Endodontic mishaps such as over-instrumentation and overfill with the gutta-percha resulted in significantly high BA score. Patients with no clinical sign and symptoms after root canal treatment and elderly had a significantly better quality of oral health related quality of life. In conclusion, presence of the clinical sign and symptoms rather than BA score affected the patient's oral health related quality of life. Thank you.